Good evening, everyone. My name's Corinna Hawkes. I'm Director of the Centre for Food Policy at City University of London, and welcome to our June 2020 Food Thinkers. It's part of our seminar series which brings together big ideas from women in academia, policy, business and advocacy, focused on redesigning food systems in its broadest sense. So it's fantastic to have you all with us this evening and to see so many people join us. Really a big welcome. So this is a webinar, our Food Thinkers webinar, so it's being recorded and it will be made available online afterwards on the YouTube channel. We are going to have our speaker followed by questions and answers. So as soon as you think of those questions, please do write them into the Q&A section of Teams, and we'll start reading them out after Claire's talk, and I will moderate that. We'll endeavour, of course, to answer all the questions, but this will depend on time. If you want to share what's going on social media, please feel free. Our hashtag is Food Thinkers, and our Twitter handle is @FoodPolicyCity. And this is part of a series. We're having them every month this year. And the next one will be on July the 15th and will be the Chief Executive Officer of the World Obesity Federation, Joanna Ralston. But tonight, I'm absolutely delighted to welcome Dr Claire Thompson, who is a Senior Research Fellow at the University of Hertfordshire. And if you've come across Claire's work before, as I'm sure many of you have, you, like me, will be a big admirer of the rigour of Claire's research and the passion that she brings to it. She's a qualitative researcher with interest in food poverty and urban inequalities, welfare reform, regeneration, as well as food environments. She's got a PhD in geography, as I do, but from Queen Mary University of London, and an MA in social sciences from the Open Universities. And she's now a Senior Research Fellow at the University of Hertfordshire, working with Wendy Wills on the applied research collaboration for the East of England. And she's also actively policy engaged, working with local authorities in the UK, developing food policy action plans. And what she's going to be talking about today is the relationship between food, precarity and poverty in public health. And the approach that we take at the Centre for Food Policy to food systems is that food systems embed multiple systems, and those systems include the systems in which people live their lives. And understanding those systems and how they interact with food systems is a really important part of our efforts to identify how can we most effectively reshape food systems so they can be more effective. So I won't talk any more about what Claire will say, since she's here with us to present it herself. So with no further ado, I will hand over to Claire. Over to you.
So what I'd like to talk to you about this evening then is something myself and colleagues have been thinking about for a little while now, which is the relationship between food, precarity and poverty, and how we think about that in public health. So they do that really by talking about dietary health inequalities and the conditions that lead to dietary health inequalities, but doing that in the context of a kind of pervasive and ongoing and corrosive precarity and insecurity that people are increasingly experiencing if they're on a low income. So I want to do this by reflecting on some qualitative work and looking at how this relationship works and how this happens both structurally via the social determinants of health, so housing and income and those things, and then linked to that, of course, by looking at people's lived experiences of precarity and how in the long term this kind of erodes self-care and health related behaviours, and especially dietary practices and food and eating. So just a little bit of background then. So obviously we know there's a social gradient to dietary health, and that socio-economic differences of diet are responsible for all sorts of adverse outcomes. We've got now this kind of odd paradox that those negative outcomes, some of them are around obesity, and yet some of them are around nutrition. So this kind of polarisation is a real sign that something's quite wrong there. So we also know that in more disadvantaged areas, people are more exposed to fast food outlets and more exposed to advertisements for unhealthy food. So you've got this kind of amplification. And on top of that, that affording a healthy diet is increasingly difficult as living costs go up and incomes come down. And then the backdrop of that is welfare reform and insecure work and widening inequality. And as we'll come on to right at the end, these trends, of course, are being exacerbated by COVID-19 and the lockdown. So we think at the moment about 24% of adults and 19% of children under 15 in the UK live in food insecure households. So it's a real problem. So thinking about how this links to precarity. So precarity is a term that's been used as a sociological concept, and it kind of describes this constellation that we have at the moment of insecure work, so like 0 hours contract, and state retreat and welfare reform at the same time, which leads to this kind of chronic, episodic, ongoing insecurity for some people. And in the sociological literature, they describe people experiencing this in the longer term as precariat, so like a social class of people who suffer from precarity and a lack of security around their most basic needs and their psychological welfare. So in public health, we talk about it in terms of the social determinants of health. And from the qualitative work we've done, really, it leads to kind of a very distinct set of experiences and subjectivities around poverty and around need and particular types of stigmatisation and difficulties, including those around diet. So when we think of precarity in terms of health, then, thank you, it's damaging for health because you get this intersection of complex needs around your material securities. And thinking about food in this context, food for the people that experience it is just going to be one element of that. If they're worried about their housing, if they're worried about their income and making ends meet. And this particular type of poverty or experience of poverty is a very stigmatising way to live. Like if you live in a very insecure and precarious way, you don't get treated very well often by healthcare professionals and state agencies, and it's going to be very detrimental to health. And the authors mentioned above, so Whitlam and Weiser, talk about this as precarity as a type of structural vulnerability. So it makes you more prone to health problems and to negative outcomes. If we think about it, I suppose, in terms of the social determinants of health, if you've got a lack of security, if you've got ongoing precarity around the things that are kind of important in your day-to-day life and getting by, then you have this experience in the temporary and the emergency, but in perpetuity, as in all the time, what used to be called or is still called sometimes living hand to mouth, so not knowing how you're going to get your needs met. And because of this, you end up with high levels of interaction with and reliance on state and third sector agencies, and some of those can be hostile and unhelpful and upsetting. So if you're in receipt of different benefits or you're getting help from third sector agencies and you've got health problems, poverty, as some of the participants describe it, can be a full-time job, because you are constantly appeals, appointments, proving eligibility, proving deservedness, turning up to access services at certain times, and then you might have your own health problems and your own children to look after as well. And often these systems are quite contradictory. So you might try access one resource where you have to emphasise a medical condition or incapacity, and at the same time try and access another resource where you have to demonstrate your willingness and capacity to work. So these things kind of butt against each other, and it's marginalising and it's difficult and it's time consuming for people. So just to illustrate that, I've got a couple of quotes here from GPs who often get pulled in to this kind of social administration of poverty for people. So people come in with health problems, but what's really bothering them is poverty related problems, or they come in with a handful of brown envelopes because they need help with benefit appeals or something, or proving incapacity. And in 10 minutes, it's very difficult for the doctor to do, and they don't want to fob people off. And again, these workarounds are detrimental because they might feel compelled to sign someone off for work because they know they're getting a bad time from the job centre. And the people in the middle of all this kind of negotiation between different agencies and different systems are the people experiencing insecurity and precarity. So you can see it's got quite a corrosive effect on people. of course, the implications there for self-care of the diet are going to be as it just slides down the priority list. It just becomes less and less of a priority for people because they've got more pressing material needs. There's just other things that they have to get sorted out. And then if they do have a bit of breathing space, they're probably not going to be thinking that much about food, and also the stress and anxiety that goes with it. And I think in the longer term, if you live a precarious existence, you might have all sorts of coping strategies. So drinking lots of energy drinks to get through double shifts, and then maybe drinking alcohol to get to sleep after you finish your shifts because you've only got a few hours before you pick the kids up from school, or comfort eating to deal with addictions or to help you stop smoking. And none of those things are good for your diet because the coping strategies that you've got to deal with more difficult areas of your life eclipse them. Think about it then in terms of the social determinants of health. One of the biggest ones that comes up is housing, which is a huge issue in urban areas, of course, especially London. And if you're in temporary accommodation, especially, you might not have access to an oven, you might just have a microwave or a kettle. You might have to share a kitchen that isn't very clean. People might steal your food. You might be in shared housing with people who are potentially threatening or not very nice. And all of these things mean that it's safer to stay in your room or to eat out or to just not try in the first place, maybe for the first couple of weeks. But if you're in temporary accommodation that stretches into months and years, what happens to cooking within that? It becomes easier if you've got the money and safer to get a takeaway or something that you can just eat out of the packet in your room. And there's a lot of work being done by local authorities and by charities, food banks to try and help people with this. So kind of no cook food packages, or trying to help people and give cooking lessons around eating when you haven't got a lot of access to these services, but they can only do so much. If you haven't got space and storage and you can't put money on the gas and electric in your housing, you're not going to be able to prioritise a diet. In relation to income security, again, food ends up on the back burner. So this could be because of work or because of benefits. But to give you an example, there's a quote here for a man who got his benefits suspended, quite serious health problems. For 6 months, he got them back. But in that meantime, he had no money. So he started going to the food bank. But he had no money to travel to the food bank, and because of his COPD, it was difficult to get back from the food bank with all the heavy stuff you get there, like jars and tins. So it would take him pretty much best part of a day to walk there with one of those shopping trolleys, and then to walk back, and then having to stop because it's heavy and to keep using his pump. I mean, you might do that for a few weeks, but if that was how you had to live for 6 months, how long would it take for you to just eat chocolate bars or biscuits or things you could get out of cheaply from people you know or from the shop, and just not go through this process just to get access to tinned food? So you can see that kind of that corrosive effect of it. Caring responsibilities is another big one for people, especially in light of benefit welfare reforms. So to give you an idea of that, there's a quote here from a lady who had a son with an adult son with autistic spectrum disorder. So she was caring for him, which was quite hard work, and he was quite a picky eater on top of it. Mother and father were elderly and lived close by, so they needed for her to go around every day to help them out. At the same time, her former mother-in-law got very ill. So in the end, she was spending all her time looking after people, cooking for them, feeding them, helping them go to the appointments, everything that goes with it. She got into a lot of debt doing this. She stopped eating properly because she was prioritising everyone else's needs. And even when she got a food bank referral, she didn't go for 6 months because of the stigma, and because she kind of, as long as she could look after everyone else that needed looking after, she didn't go. It's only got to the point where it would impact on other people's diet that she went. So if you've got those sort of responsibilities in the long term and very little support, it's not very good for the food that you eat. And again, not even accessing the food bank straight away was a socially acceptable option for her, unfortunately. Thinking about other kind of structural determinants like the food environment. So when we think about unhealthy food environments, there's kind of an acceptance that they're sort of symptomatic of all these different interacting problems and systems. So that's household poverty and area level poverty, and the actions of the food industry in targeting particular places where they know and they're going to be able to sell those goods and advertising. But overwhelmingly, as academics, when we talk about the food environment, we mean the retail food environment. We don't mean the whole food environment. And if the trends that are going on now continue to happen, you know, the diets of low-income people are going to be characterised increasingly by significant amounts of donated and surplus food. So we need a much more holistic idea of the food environment. And some local authorities do really well on this, like places like Greenwich, where they try and get this like holistic model of everything to do with food within an area and design work around that. As academics, that's something we probably need to do better. Okay, so another part of thinking about the food environment obviously means thinking about fast food, and there's a lot in the press about this. And chicken shops is a particularly popular example, and they are a very common feature in low-income neighbourhoods all over the country. And we know the health effects of this are not good. The people who use them know that, but the density, when you think about it, there's more than 70 chicken shops per London borough in some of the more deprived London boroughs, and they still continue to be a really popular feature of the local community because, again, if you're not sure how much money you've got, it's cheap, it's filling, it's palatable, it's a place where young people can meet and have a space and share food together, be relatively safe, it's open long hours. It provides lots of other things other than food that make them these kind of valuable spaces. But the problem with this is that it can overlap with other sources of food that might be healthier. So there's a quote here from a brother and sister, two teenagers who are at secondary school. And the brother was telling me that the family were living in temporary accommodation, but they'd been there for a couple of years. They were waiting to get moved. It hadn't happened. So things were like sort of half packed up. So packed lunches weren't really an option. And the family was eligible for free school meals. But he didn't use his free school meals. So his mum would give him money to get food to go into school in the morning on the way to school, and then free school meals for lunch. But instead of doing that, he'd eat nothing on the way to school, save the money, not eat his free school meal at lunchtime. And then as soon as school finished, he'd take his breakfast money, having not eaten all day, like about 3:30, and go straight to the chicken shop so he could eat with his friends in a socially acceptable way and be in that space and use the food environment in the same way as his peers did, even though he paid quite a price for that in terms of his own health. Also with the food environment, on top of fast food outlets, if we think about food shopping, so some typical images here from food shopping in a supermarket, which are normally filled with special offers, but don't seem to be now at the moment. And when we've looked at the type of ways people make choices in the supermarket about food and what they're going to shop for, there's kind of a spectrum between high and low agency. So you can have the very high agency sort of approaches where you're going with a list or a budget, or you're going to plan a certain amount of meals for the week, or particular things that you eat at the same time, and you go in, you shop for those household food practices, and you come out and you can do quite a healthy shop. On the other side of that, you can have quite a low agency approach where you just kind of bounce around the store using the special offers or the displays as a kind of a cue to buy things. And not all of that's about health or income. Some of that's just about how you enjoy doing your food shopping, the sort of experience you want. Do you want it to be a more, are you food shopping as a consumer? Are you thinking about enjoying that process and getting something novel? But unfortunately, what tends to happen is that people on low incomes, of course, are going to be more likely to be affected by these special offers, less likely to be able to adopt these high agency strategies to navigate the store environment, because that requires somewhere to store food and the ability to plan when you're going to be in, what you're going to eat, when you're going to eat together, being able to put money on the gas and electric and doing things in a relatively predictable way. If you are on a low precarious income, you can't do that, so you're going to be more attracted or more susceptible to special offers and to things that are palatable and quick, and those tend to be the things, unfortunately, that are on special offers. So last part of the food environment we might think of then is one of the non-retail parts, which is food banks. And food banks provide emergency food, and often that's under a referral system. And access to food banks in themselves is precarious because of this referral system. Some agencies and some actors will refer and others won't. And there's a notion of deservedness that can go within that. So depending on where you live and how many food banks there are and what sort of relationship local food banks have with local health and social care providers and community groups, that can mediate how much food you're going to get. And if you're using food banks, and this is not to denigrate the work that food banks do, because they do fantastic work, and some have lots of access to fresh food and do cooking classes and lots of wonderful things, but that's not all food banks, and it's still a struggle to maintain a healthy diet from donated food. Some obviously don't have any fresh food at all. It's not food you'd necessarily choose. It might not be food that's culturally appropriate to you. And while it's one thing for adults to eat that, it's quite difficult to get children to eat it. Experiencing food poverty can also be a barrier to breastfeeding. If you're not sure where your next paycheck or meal is coming from, the kind of consistency and persistence required for breastfeeding is difficult. And then if you do get given formula milk from a charity and that gives you a little bit of a break, how do you go back to breastfeeding, and do you? So it's just an additional barrier for health and for diet. And there's ethical problems or dilemmas with this as well. So quite a few people who volunteer for food banks do so because at some point they've been clients at the food bank and they want to kind of give something back when they get on their feet and volunteer, which is lovely. But for other people, again, because it can be a precarious existence, there are periods when they are doing relatively well and they're volunteering, and then other periods where they're not doing so well, and then they switch into being a client and they go between the two. And sometimes that settles into volunteering every week and taking a few bags of food home as a compromise. And you can see why it happens on both sides, from the volunteers and the food bank organisers. But kind of structurally, that's not a way to deal with the problem, because you've got kind of people in need working for donated and surplus food. So it poses all sorts of problems around stigma, around dignity, around sustainability, about how we use that as a resource for people. Okay, so thinking about all of those things, I guess, around precarity and health and food and the social determinants of health, and then we have the coronavirus pandemic and the lockdown on top of that, and it's kind of exacerbating a lot of those problems. And it's making vulnerable people, in some cases, more vulnerable, and putting people who weren't previously vulnerable or insecure into those situations. So obviously it's going to impact on food. And on a more systems or structural level, it's highlighted gaps in provision and coordination, and highlighted where cuts have been made in previous years. So what we're currently doing at the University of Hertfordshire, led by Wendy Wills, is a study, a qualitative study, on the impact of coronavirus on food and eating in the east of England. So we want to see how the lockdown and how all the structure around it, how that's affecting food and eating, and how that's affecting the ways we respond to people in vulnerable situations. So we started collecting data for this beginning of May, and in total we want to interview around 100 East of England residents with a particular focus on people who might be vulnerable to these problems. So families with young children or school-aged children, those over 70, people on a low income, people in receipt of free school meals, people who might be self-isolating, shielding due to a health condition, and looking at key workers. And then alongside that, we're speaking to kind of up to 60 volunteers and professionals who are trying to support these people. So we've only been interviewing for just over a month, but of course we've got some emerging findings. And one of the big things that is coming out, which probably won't be a surprise, is the potential of the pandemic to amplify existing inequalities. So people who've not been that financially impacted by the lockdown, like inconvenienced, yes, but not, you know, not financially impacted, then they can take a little bit of time sometimes to focus more on their food. If they're working from home, to cook from scratch more, buy more fresh fruit and vegetables, eat as a family, try new foods they haven't tried before, spend more time in the garden, do a barbecue. So really try and focus in on food and improve it, and think, you know, by the time this finishes, I know I've not got an excuse for my diet not to be good at the moment. But those who are more heavily affected by the lockdown will have had to compromise the quality of their food. If they can't get out to get food, rely on donated food, maybe from family or friends or other people who are shopping for them, or the food packages going out, or food banks, or skip meals altogether. So we're thinking about, by the time the pandemic finishes, or as we come out of this, are we going to have improved the diets of some people and worsened diets of others? Will that be the effect? Notes on that. So this one is from a lady, a retired lady over 70 who lives on her own in social housing, and she reported just not eating very much since the pandemic. She's been in, she's not spoken to very many people, she can't see her family apart from to like kind of drop off some food on the doorstep and then leave. So one of the things she stopped doing was buying fresh food so much, and she didn't want to be a bother if she gave her daughter-in-law a list of shopping, so she tried to keep it quite small, and she just ended up eating kind of tins of soup a lot, or tins of soup over pasta. And she reported that she'd lost weight since the lockdown started, whereas other people, and I'm sorry, I'm just going to share and unshare to show you. Whereas other people who might be working from home, still got the same income, still got some social interaction, even if it's virtual for work, find that they can structure their day very differently. So the lady here is an office manager, saying that she'd go for a run because she wasn't commuting, come back, make a nice breakfast, do some work, take lunch in the garden, do a bit of exercise, making sure she had enough fresh fruit and vegetables. So trying to make herself a lot healthier during this period, because she wasn't eating on the go, wasn't drinking as much coffee, and not having the time taken out of her day for a commute. So a real difference. And another thing that's coming out of the data so far is how the agencies who are supporting vulnerable people in their diet, how are they going to deal with the increasing need in the long term? It's not sustainable. So speaking to food banks, there's a quote from a food bank organiser here saying that 60% more food parcels than what they were doing since last year. And it's not just giving them out, it's all the work involved in kind of processing the donations. And obviously the referrals they get, referrals for sickness, are a lot higher. And at the same time, their volunteer base, who is retired people, are self-isolating. And even if they get new people in, they've still got to be kind of trained and find new ways of working. So they're under immense pressure. All of this is going to have an impact on the diets of the people who are using those services. So just to finish off then, if we look at these trends around food, precarity, and poverty, and then look at the kind of amplifying effect coronavirus is having on that, I think then maybe we should have kind of renewed hesitations about interventions or policies that look to build resilience. Because when you look at what resilient behaviours mean or what they entail, you know, resilience is a popular concept, and there is work around community resilience. But if you look at it on an individual level, in order to get by in these situations can mean doing, pre-planning and taking your time and being very careful, but also doing things that could be undignified or untruthful or upsetting or stigmatising. And time consuming, and a lot of behaviours that would be considered resilient maybe in terms of feeding your family are not ones that you want to have to do, and certainly not ones you want to have to do in the long term. So I think it's worth thinking about a renewed emphasis on structure again, because even to be resilient kind of implies that people have these resources and reserves that they can draw upon for resilience, and precarity by its very nature means you can't. So we need to think about this more in terms of structure. And upskilling or resilience can only ever really be a small part of that. And I think this is evidenced in the local responses to COVID-19, showing that maybe when we think about resilience, this needs to be on a community level rather than individual level, because if people are experiencing precarity, then that kind of goes against the idea of resilience, and it's only going to make dietary inequalities worse. Very much for bearing with me through my technical difficulties, and I hope you can still hear me. Thank you.
So thanks so much, Claire. There are some questions for you already, and for those participants, please do fire away with more questions so we can continue with them. So the first question for you, Claire, is from Tammy, and she wants to know what your view is on food deserts. So, of course, we know that food deserts is a very popular term, and it has implied in the past the idea that if places aren't affordable, that are around you, and if you don't have shops around you, and it means that people just go and eat takeaways and so on. How direct a relationship do you see between the fact that some places have poor food access and what they're eating?
Okay, well, food deserts isn't so much my area, but I know Diana Smith is kind enough to listen, knows loads about it, so she might be shaking her head when I answer it. Sorry, Diana. I think from the research, food deserts are much less of an issue in the UK than they are in the US. And there's been kind of mixed evidence for how much you can apply that to the UK, the idea of a food desert, simply because of how big we are as a country and the spaces in between things. But maybe it's time to kind of revisit that. And look at food deserts, maybe not just in terms of like physical access and how spread out things are, but access in terms of like socially and financially and culturally, can you access different resources? So not just in terms of space or place, because I suppose for some people, maybe the same place or the same physical space can be quite acceptable for some people, and then something of a food desert for others.
Great, thank you. Do you have, Tammy also asked actually as a follow-up about whether you have any statistics for food bank use during the lockdown, and do you know if there's any particular areas, geographical areas, that have had a greater problem? I know that your work is in the east of England, but is there any insights you've got on that?
No, I don't actually. I'd be interested to know though. I think that's something colleagues are talking about, the Trust will trust too, definitely. But yeah, I'd be interested to see where those hotspots are.
Yeah, no, it's a good question. And when actually, sorry, I wanted to ask this myself. You presented those fascinating initial findings from the East of England study. Do you know when you'll be done with it and we'll be able to share the findings more fully? Well,
we've put in ethical approval to kind of go for 12 months, so we might be doing follow-up on it, but we're definitely going to present findings as we go along. So there's the Enough conference next week, so there'll be some more findings there, and we're part of the aim of the study is to turn it into feedback for local authorities and make it public as quickly as possible so it's useful. So soon would be the non-specific answer to that. Yeah, as soon as we can.
Thank you. And now I've got a couple of questions here about supermarkets, and the first one is, when looking at food environments, have you looked at supermarkets vis-a-vis the smaller shops, and do you have any comment regarding the discourse, the narrative which comes out that supermarkets are successfully feeding the nation, and they've been spectacularly successful in making sure that the nation of every part of the country and every type of socioeconomic group is being fed? So two related but different questions there.
Okay. Well, we've had some comments on this for the study we're doing now on food and coronavirus. So people have talked anecdotally about supermarkets and versus local shops. So some of it's the stuff you'd expect, like it's impossible to get a delivery slot and there's queues and I don't like it, and you know, all the rest of the things. But also people saying that they've not been to a supermarket since the lockdown and they don't get deliveries, and just going back to shopping in their local shops and saying, actually, I might just keep doing this because we're not eating that different a diet. We're not doing this big bulk buy. I am eating better because they're shopping more often and they're buying fresh stuff. So in that sense, certainly for the interviews I've done, smaller shops are very popular, or there's kind of a renewed respect for smaller shops. The extent to which supermarkets might be feeding the whole country, I don't know. I'd be quite cynical about that. But I don't know. I don't have any data on that.
Thank you. Got a lot more questions here. What is your view? Are you encouraged or discouraged by the responses to the coronavirus from local and national government regarding these links between food and precarity? We had our last Food Thinkers last month also dealt with this issue in a very different way, and we had that conversation about both national and local government responses and whether that had been adequate and so on. What is your view on that?
I think from the people I've spoken to so far, I've been really encouraged by the local government responses, how hard they're working, how difficult it is to respond to that, and how they've tried to think about vulnerable people and design food packages and help for people who might be in temporary accommodation and who might have particular problems that need responding to. Like, a lot of thought's gone into that, but I suppose the speed of it means that to an extent it's always going to be a bit of a blunt instrument. And while it's good in some ways, I suppose they've got quite a lot of discretion about what they do. Like, there's no plan for this. There's no plan for this especially, and I think that's part of the reason for doing the study, is to feed into future planning for it. And
you mentioned some local authorities who, and you said had a view of solving this problem in a way that was positive and holistic. Do you have any particular names that you're able to share, or perhaps it's best followed up with the person who asked the question, but is there anybody that you'd like to highlight, any particular local authorities?
I probably shouldn't, but yeah, maybe whoever asked the question, we can have a chat. We can have a chat later.
Sure. Okay. So we've got a question from Flora Douglas here, and she asked, what are the implications from your thoughts and these findings for health professionals tasked with encouraging dietary behaviour change, when clearly individual capacities and capabilities to do so are not the same for everyone, and particularly challenging for the groups you are referring to in this presentation? So what would you advise health professionals in this tricky situation?
Oh, I don't know that I'm qualified to, and it wouldn't be a job I'd like, having to do that, having to interview some of those people. It's really hard, because if someone's having problems with where they live or domestic violence, talking to them about diets can be a difficult thing to do. But I suppose when I've spoken to professionals who feel like they're doing well with it, it's always about onward referral and joined up services and coordination, so that you can help someone address maybe the structural stuff that's troubling them, or the wider drivers of what's wrong, at the same time as trying to help them to look after themselves. But in some areas, depending on what the infrastructure's like and how the different agencies work together, that's easier to do than others.
Thank you. And another question here from someone who's asking about whether there's any evidence that giving access to people to community gardens or allotments to grow your own food, do they do any good for this group?
I don't know. I don't know. I mean, I don't think that could be a bad thing, doing something like that. But, if you're looking at people with complex lives and they might be working long shifts and lots of pressures on, taking time out of your day to go and do something like that might not be a possibility. It might be more kind of immediate or pressing concerns, but that's hard to say.
It is hard to say, isn't it? Because in one sense you think this is an ideal solution. On the other hand, it's the very worst, because it requires so much effort and resource and dedication. It would be interesting. And another one, a very specific question about the quote that you had from the dietitian about breastfeeding. Could you say a bit more about that?
Yeah, I mean, there's guidelines on it now, but it was always a bit of a bone of contention that some food banks would offer formula milk, or not just food banks, but anywhere we know where you get surplus or donated food from, and some wouldn't. And then if they do, is it in date? Are they supposed to? Are they discouraging breastfeeding by doing that? And then some clients who use food banks would ask for that. So it's very tricky. And then within food banks or some centres, you have baby banks that deal just with like nappies and formula and stuff for babies. So you've got public health advice about, you know, like a preference for breastfeeding and how good that is for infants. But then also people on low incomes are going to be less likely to do that. If you don't know where your next meal's coming from, even your capacity to breastfeed will be reduced. You certainly wouldn't be able to necessarily devote the time you want to it. So there's a concern sometimes amongst dietitians or some of the community public health people that food banks were getting in the way, in the nicest way possible, of breastfeeding. But it's coping strategies and overriding needs, isn't it? Like if you can provide formula and you can sort out one problem, then that longer term stuff or the longer term considerations about the benefits of breastfeeding, they fall by the wayside a bit.
That's a theme. I mean, it's very clear from everything you've said, Claire, and it was very powerful the way that you've articulated the enormously the pure logic of the reason why this is a logical outcome, why what people eat is unhealthy is a logical outcome of their circumstances. There's a question from Alexandra here, who says she's been volunteering at a food bank in London, and they've been managing to give people fresh vegetables most weeks. So if you could comment on that, but also she says, especially given what you said about the way that people use fast food and chicken shops, should they be restricted, and if so, how?
Wow. Yeah, I mean, some food banks do great stuff, and they manage to get fresh food, and they've got good networks, and they even do cooking classes within that. But it's really, really variable. Depends on where you are in the country, depends on the capacity for volunteers and how much access they've got to food. So it's quite difficult to make generalisations about food banks themselves, but it's always good to hear ones that are able to offer more fresh stuff. I'm sorry, what was the second part again? I got distracted by food banks.
Yeah, sorry, it was about whether it's the right question to talk about restricting chicken shops and fast food places, given your findings in that area.
It's odd, isn't it? Like from other research, people are very much aware of their health damaging effects of things we shouldn't eat or drink or smoke, but when there's talk about banning or restricting it, it's always very, very unpopular. And I don't know, maybe if some of that's just cultural, but I don't think that chicken shops are the problem themselves. You know, it's the poverty around that. I mean, yeah, you could restrict the number of chicken shops you give licenses, but if local authorities are granting those licenses, you know, they bring in income and then they help pay for services and people use them. So it's how you weigh up that against the health benefits. But I don't think a place to start is banning chicken shops. I think it's the poverty and the insecurity that means that people rely on them more than they maybe should do that's the issue, rather than the chicken shops themselves. Because if not, then would it be something else?
Yeah, and there's another question here from Mary, who says she's intrigued about the role of chicken shops as a social gathering place for youth. Yeah. How to address that? I mean, you've been very clear in your previous response that the problem is poverty, and to start there, but is there any way of tackling the social gathering role of chicken shops?
Yeah, I mean, there's been some interesting work and experiments done around London about having like social enterprises and healthy chicken shops, and some of it is that they just fill a gap. You know, there's less leisure activities for young people to do that don't cost money or a lot of money, that there are places they can congregate. You know, maybe if there was more of that, there'd be less emphasis on the chicken shop. But again, it's structural stuff, isn't it, that makes that an attractive space. It's not an attractive space for everyone, is it? It's an attractive space probably for people who haven't got many other spaces they can occupy.
Very well said. I've got a couple of questions here about local authorities again, following the previous answers that you gave. And one from Anthony, he says, since upskilling individuals' resilience is only a small part of the solution, do you have any practical recommendations for local authorities and for communities for addressing food insecurity in the longer term? Like, what can they do in the longer term?
Oh yeah, I wish I knew. Some of the local authorities that I've worked with, have got like very holistic food poverty action plans, or they've got very coordinated systems for kind of helping people with different areas of their life at the same time. That's one way of addressing it, but it's like some of the participants say, food poverty isn't really about food, it's about poverty. So it's the capacity or to what extent at local authority level, which is really hard, you can address those driving those problems. You can't put someone's wages up and sort their housing out necessarily, but you can give them food.
Yeah, it's the art of the possible, isn't it? But Claire Perrier asked a question also about local authorities and asked if there's any evidence that local authorities are communicating with each other about how they're dealing with these issues. Are they exchanging best practice, or is it really about let's just get the food sorted out and it's an emergency and we'll deal with it, or is there a bit more of a structured lesson learning approach that the local authorities are taking when it regards to learning from each other?
With coronavirus, I don't know, actually. I don't know. I mean, you would hope that local authorities are talking to each other, and I guess maybe that does happen in some areas where there's an established relationship. I honestly don't know. Sorry.
Okay, no problem. It's another couple of questions now on food banks. Actually, a really interesting one, following up from the previous comment by the volunteer at the food bank in London, who made the comment that fruits and vegetables were being provided through food banks. And yeah, it's Dave Beck, and he says, is it right that food banks should start to include vegetables? Does this not start a process of normalization?
Yeah.
And then there's a whole lot of things that follow on from that. Infrastructure to support storage of fresh food then becomes necessary, creating further pressures and so on. What are your views on that? Really interesting question.
It's such a hard thing to square morally, because the better they do and the harder they try and the more people they help, the more embedded and relied upon they become. It's that kind of the way a lot of the quotes started off was, we shouldn't need to be here, but and yeah, it's got a point. So the more food banks do, the more they'd be expected to do, logically. And I think that's the whole rationale behind that kind of limiting of referrals. So you only get a set amount of referrals with a lot of food banks over so many months or over the course of a year, so that it doesn't become a regular part of your diet. But in practice, that's really hard to enact, because how do you tell people no when they've got nothing else to eat? And the same with the fresh food. If you don't take fresh food, but then you get a supermarket offer you a job lot of X, do you let them throw it away, or do you find somewhere to put it and then try and get it out to people? By its very nature, it kind of grows and it reproduces with food banks.
Yeah, it really is a dilemma. There's a brilliant book by Janet Poppendiek written about the American situation quite a few years ago, which is an absolutely brilliant exploration of these tensions, which is, yeah, I'd recommend to anyone. Robbie Davison has a question about food banks, though, and despite the fact that some food banks are giving out more nutritious foods, and there are still nutritionally challenged parcels going out that they're saying that the food banks are saying that they're nutritionally balanced, but in fact it's all a bit random, and most of it is very highly processed kinds of foods. What are your thoughts on, does it not matter? Is it just, it's food and therefore then it's important, or does it actually matter when it is not very healthy?
Yeah, I think of course it matters, but it depends on, you can only work with what you've got. If that's all you've got in and that's all the budget, you haven't got any budget to buy anything else, then giving some food is better than giving no food, because if you're having a bad time, that kind of healthy versus unhealthy gets reduced to food versus no food. So in that context, then yeah, some food is better than none. But what do? It goes back to that embedded question, doesn't it? The food banks who do better and who are good at fundraising and build good relations with supermarkets, they get more fresh food in, and then the better they do, the more clients they get, the more they're relied upon.
Yeah, it becomes a vicious cycle, doesn't it? My colleague Lindy Sharp has just posted a comment saying that she believes that there is communication between local authorities that are members of the Sustainable Food Places Network, formerly Sustainable Food Cities, with many local authorities and health and food workers. So if the person who asked that question is interested, look to the Sustainable Food Places Network, where resources around the coronavirus are being shared. There's another comment here about just this issue about the danger of the over-reliance on food banks, and saying, you know, we clearly agreeing with you really that we need more to support structures and solutions, including at the local level. But there's another question here from my colleague Anna Isaacs, who's saying, given that we've known this issue about structural influences on diet health for so long, and there's been an argument but that's been made for so long about the structural determinants of what people eat, and what you bring to it, Claire, is a really fascinating and nuanced way of understanding the intersection between food environments and structural factors around people, as well as structural factors in their lives. So what should researchers actually be doing if they're trying to provide evidence to inform meaningful policy change, given that we've already got a lot of evidence that structural influences matter? What should we be doing?
Oh, I wish I knew. Some of the suggestions I've heard lately is, you know, if you want to try and affect changes, is linking it more to cost, which unfortunately I don't know how to do. But, you know, like if we cut this back in the housing, if we do cut costs here, if there's less help for people here, then this manifests as these costs and this reliance and these problems later on down the line. So, you know, just highlighting them causal pathways and mechanisms by which the structural stuff stores up problems for later and then stores up chaos. How you do that, it's another matter, I guess.
Yeah, it's making a case, isn't it? There's another question here about researchers. That's from Sally Sutherland. Thanks for your question, Sally. About how can researchers make sure that the voices that are heard during COVID include mothers, children, and primary carers, especially those who are living in or have experience of poverty? These are often people on the front line of food and feeding. Are these perspectives going to be silenced due to the fact that they have caring responsibilities and COVID impacts?
Yeah, it's a really good point. I think there's a lot of researchers at the moment trying really hard to connect with those people and to hear their voices. But again, with this kind of amplification effect of coronavirus effect, I guess it's harder. It's hard to get to those groups anyway, but it's even harder now if we're relying on internet connection, and have you got a smartphone, and have you got a laptop, and have you got credit on your phone. It gets even more difficult to get to those people. But I think there's a lot of work being done around that to try and find ways around it, but I don't think it's going to happen overnight. I think it will take us a while to researchers to learn lessons from that and find new ways of getting to those voices, but we need to.
Yeah, no, it's a really good point. I think extra effort needs to be made, isn't it?
Yeah.
Just before I move on to the next question, and thanks to everyone for your fantastic questions, just to let you know that if you do want to sign up to our mailing list to hear information about Food Thinkers seminars, please do put your name and email address into the Q&A. It won't get published, it'll just come to us. I should have said that earlier. So please do let us know if you'd like to join the mailing list if you're not already part of that. So another question here, what are your thoughts about how the government has been dealing with free school meals since lockdown started and that schools have closed down? I believe just not so long ago, a few hours ago, Marcus Rashford's request campaign, if you like, to have the ending of free school meals in the UK during the holidays actually continued has actually been successful. But there's obviously been a lot of changing minds that have been going on around this area. So what are your thoughts about the role of free school meals and the roles of schools since lockdown and the way that the government has dealt with it?
Again, it's very variable from area to area, how different places are trying to deal with free school meals. So some places you might go and pick your free school meal up, you might go and pick a shopping bag up. Other places they're trying to drop them off. But again, with kind of more marginalised groups, you might not have a current phone contact. Their family might not be living in the place they think you're living in them. Contact might have dropped off over the lockdown. So there's all those kind of challenges to overcome, and there's not one approach from what I can see to doing that. That's something that's kind of being dealt with at a local level. But if they are going to have free school meals throughout the school holidays, that would be a great start, I think.
And thank you. There's a note here from Margin saying that for those of you interested to understand how lessons are being learned across local authorities, that the London Food Borough meetings, which are organised by the GLA, the Greater London Authority, every 2 weeks, have these meetings, and they're great meetings. I can attest to that, and that they share their response to coronavirus and invite speakers from organisations to talk about what they're doing. So again, if you're interested in knowing and interested in sharing information, those London Food Borough meetings organised by the GLA. Thanks very much to Margin for highlighting that for us. So another question about Brexit, which always comes up. David says, fantastic talk, and I've had a lot of people say that, so thank you. We've got the combined scenario of COVID and Brexit looming, with possible cheap, unregulated food imports. Is this something that concerns you, or is it too distant from the realities of people's lives to focus on?
It's not something I know a great deal about, but as you describe it, yeah, I mean, the thought of more, even cheaper, even less regulated food is not a good one. But I don't know how much coverage that's going to get, actually, considering everything else that's going on. So it'd be a worry in case anything kind of slips under the radar with that.
Yeah, no, it's yeah. Interesting times ahead, one might say. There's a couple more questions about urban gardening. There was already a question about allotments and urban gardening and about whether they had a role or not. I'll read it out. It's from Fariha. And she says that there is a community gardening project in Southampton commissioned through the local VCSE provision, where people out of work with mental health issues can help maintain an allotment. Lots of people who live in precarity have volunteered at this project, and it seems to have some impact, if not on their precarity, but on their resilience and social confidence. And the volunteers do get to take food away during the harvest. So thanks, Fariha, for sharing that experience with us. Any comments on that, Claire?
I mean, I think they can be lovely. I went to one in Jaywick as well, and sort of all over the place you've got these community gardens springing up as well, and they're, as you say, they're therapeutic spaces as well, which is lovely. But I think they're nice in augmenting the community and giving people a place to meet and boosting well-being. As a food solution, probably not so much. You know, there's food benefits to it, but I don't think it's like a systematic national level way of feeding people or addressing food poverty in that way. But that doesn't detract from the possible benefits for kind of health and well-being and time spent outdoors.
So the other question was also asking for your comments about increased support for local community gardens. But the question asked, was it an issue? Did community gardens actually come up during your research?
On food poverty, no. But then I was doing that in quite an urban area, and I didn't interview a lot of people who are more of the age we associate with allotments. So maybe that was some of it, but no, it didn't come up.
Okay, interesting. So Have you got any, this is a question from Michael, have you got any thoughts on the long-term effects of coronavirus? You shared some ideas from your current findings, and you did say that you might do some follow-up, but do you expect these findings, as in some benefiting more and some suffering more, which I have to say has also been found in some other surveys as well? It's coming out as quite a pattern in the surveys that we've been reviewing at City. Do you expect these to be solidified in coming months, or given that the lockdown is easing, rightly or wrongly, in this country, would you expect things to revert to what they were like before? Do you think they're going to actually have some permanent changes, long-term effects?
I mean, it's speculation, but I wouldn't expect things to just go completely back to the way they were. I think the longer this goes on, the more embedded people get in the practices we have now, for better or worse. So the degree to which it changes and for who, as we come out of it, would be very interesting. And also what it will do to our food systems. So, you know, from the research that local authorities and food banks and charities are working in new ways. And some of it's positive, you know, that they've made new connections and they've got new systems going, and how much of that will continue and who might benefit from that afterwards would be very interested to know as well.
Yeah, it'd be interesting to see. Tammy's got a point here about the Women's Environmental Network, who have a growing initiative in London, but it can be difficult to get these to people in precarity, and ending up with a large middle class taking advantage of these, which is not, it's a very good point, not the first time it's been observed. So clearly there's a lot of diversity in those growing spaces. And Tammy also asked, do you feel that the ability to bulk buy has been a factor in shortages? And if people who have that ability to bulk buy, if that actually reflects on their diets?
Oh, I don't know. I mean, that would be very interesting. I mean, I wouldn't be able to speak to, like, if that's affected the shortages. I wouldn't have any data on that. How that affects their diet, that would be, I suppose, as we go forward with the study. Like, if you've bought, rather, like, do you eat it all? Do you end up throwing away? Are you eating different food? Do you donate it somewhere? I think that's going to be a very interesting thing to focus on, and just the hoarding element to it as well. I think that's something else I'd be interested in looking at.
Yeah, there's so many different practices, aren't there, emerging. Flora Douglas, again, as following my point on this, says that Jan Poppendiek's book about the rise of food banks in the US is excellent. It's absolutely fantastic. And she also recommends another more recently published book called Feeding the Other, Whiteness, Privilege and Neoliberal Stigma in Food Pantries by Rebecca de Souza. And she says that's also a great and worthwhile read as well. So Claire has a question for Claire, who says, a comment actually about growing your own food. She said that there's a lot of work going on with the green partnerships that might be able to answer the question, and it's important to do research around the benefit to mental well-being and reducing social isolation. In other words, as you pointed out, that these growing spaces, diverse as they are, that it's not just about the food, it's about the other benefits that they can bring. But I can see that they would be more beneficial for people who are time rich in precarity, but have relatively more time than others. So yeah, clearly a question to be answered there. But interesting to see how many questions there are about food growing. Yeah,
I think that, what do they call it in, is it therapeutic landscapes? I think it falls under, is it, in geography with that? And it's really interesting that the all sorts of all-round benefits, if you can get people into those sorts of spaces and using them, is wonderful. But yeah,
no, it is. Yeah, it is, but it needs to be done with care and thought, doesn't it? I'm gonna take the opportunity to ask a question, actually, Claire, because as I said earlier, I was interested by the point that you made about resilience. And actually it not necessarily being the right concept in this context. And I've spoken about this a couple of times since coronavirus, and I've said, the concept of resilience is in fact better than sustainability when it comes to the kind of environmental sustainability piece, because it has so much more to it about the importance of building resilience And I had been interpreting that as that structural improvements to people's lives can help build their resilience, but resilience is a goal. But you're making the point that resilience as an immediate end goal is not a good idea, because it implies directly targeting the people, and implying that somehow you need to build skills and that builds resilience. Have I understood your argument correctly?
Yeah, I mean, I think I've probably oversimplified the resilience literature a bit. I mean, it does operate on lots of different scales, and like you say, the community level or structural resilience is very, very important. As we know now, we've got the kind of response to coronavirus, that having more assets to draw upon and more resilience in a community setting is actually really important. I think, unfortunately, the message normally gets diluted down or reduced to resilience at the individual level.
Yeah, no, it's true. It's a question of what level it's at, isn't it? So I've got another question here about the research process and the study that you did in the east of England. How did you get people? There was a question earlier about hearing women's voices and caregivers' voices and so on. What was your experience of accessing people so that they were willing to talk to you as part of this study? Was it very challenging, or did you have a very easy way into that? So how did that work?
Well, we're getting there. I mean, we're only about a month in, so we're getting there. And a lot of that is like, there's just really good people on the research team who have been there for years. I've only been there since January. You've got links with all sorts of local networks, with public health professionals, with local support groups and things like that, so that they can, I say, we're getting there and try and access some of those people. But all the usual challenges you'd expect, like if you just blanket advertise a study on food, it's going to be more middle class food interested people who want to talk about food, which is great to an extent, but it's longer and harder to get in touch with the more marginalised people and those with care and responsibilities, and we are focusing on that a bit more now.
And are there ethical issues in asking people to participate when they're already experiencing so much stress?
Yeah, it's a difficult balance, isn't it? I mean, the people you want to speak to most, as with anything to do with social research where there's a problem, I guess, the people you want to speak to most are the people who are probably having the worst time. So there's that, we don't want to bother people, but also kind of need to know what's going on in order to report back. So yeah, we don't harass people, but we're trying in as many ways to make it about having your voice heard and feeding back into the solutions and having an opportunity to speak, rather than that kind of transactional, we want something from you.
Yeah, no, that's important. Okay, well, we've had an incredibly rich lot of questions there. Unless anyone has got a last minute question, oh, is there another question that's just come in? No, I don't think so. So okay, I think we'll close there. That was a very thank you so much to everyone for their questions, and indeed, Claire, thanks for a very thought-provoking and in some ways difficult talk, but a really important to be highlighting these difficulties that you've raised. And we talked about voice and the role of researchers earlier. I think just in the very basic level, just giving voice to people who don't have voice themselves, and that's what you've done this evening in the quotes that you've chosen, and the way that you've interpreted and analysed the information is really special. So thanks very much, Claire, and thank you very much for all the hundreds of participants for joining this evening, and for all the fantastic questions. So thank you very much.
No, thanks for having me.
Okay, bye.